present day, everyone. So this will be my third set for the lecture series on communicable disease. And the pictures that you are seeing now is, for me, the place that I consider the second most beautiful province in the Philippines, which is Coron, Palawan. But unfortunately, Palawan is also well known for its endemicity for having malaria. So with that, I'm giving you a lecture on the natural history of malaria. For the objectives, at the end of the session, the students should be able to explain the natural history of malaria, know the policies of the National Strategic Plan for the Control and Elimination of Malaria in the Philippines from 2020 to 2022. Unfortunately, with the current change in the government, we still do not have a new strategic plan for the elimination of malaria in the Philippines. For the global burden of malaria, based on the World Malaria Report in 2023, in 2022, there were an estimated 249 million cases of malaria worldwide, and the estimated number of malaria deaths stood at 608,000 in 2022. And if you would look at the global trends in the incidence of malaria, there's decline in the incidence of malaria through the years from 2000, but unfortunately, during the pandemic, there was an increase in the cases of malaria. And for the trends in malaria death, based on the figures, you will also see a decline in the number of deaths due to malaria, only to increase again in 2020 during the pandemic. For the countries with indigenous cases of malaria in 2022, as you can see, Philippines is still one of those countries which has one or more indigenous cases of malaria. These are the countries in red. And these are the countries which eliminated malaria. And unfortunately, Philippines is still not one of them. And for the countries which hope to eliminate malaria by the year 2025, again, Philippines is not one of these countries. Okay, so the government is still not confident that we will be able to eliminate malaria by 2025. For the Philippine burden of malaria, with the very, very effective program that we are now implementing on malaria control and malaria elimination, you can see that the burden for the transmission of malaria has decreased. Okay, so there are decreasing incidence of malaria through the years. And the number of the provinces, the one in gray line, the number of provinces that are malaria-free are increasing. These are the confirmed malaria cases and deaths in the Philippines from 2023 to 2020, from 2003 to 2023. So this is a 20-year duration. As you can see from this one, the number of malaria cases has been decreasing through the years. But there was an increase in the during the epidemic, then a decrease. But unfortunately, for 2023, there's a twofold increase in the number of cases of malaria. For the malaria deaths, the same. We have a steep decline in the deaths due to malaria because of our effective malaria control program and elimination program. We have no deaths in 2022, but again, a sudden increase in the number of deaths in 2023. So for malaria, malaria is from the Italian word malaria or bad air. It's also known as marsh disease. And descriptions of malaria cases go as far back as 3,550 BC. It is caused by the species of the genus Plasmodium, and there are 9 subgenera for malaria. For the Philippines, for the types of malaria, we have Plasmodium vivax, Plasmodium malariae, Plasmodium ovale, and Plasmodium falciparum. Plasmodium falciparum is the most common cause of malaria in the Philippines. A PF case of malaria is Plasmodium knowlesi. Okay. So Plasmodium knowlesi is a primate malaria parasite commonly found in Southeast Asia, including the Philippines. It is caused by malaria in the long-tailed macaques. Plasmodium knowlesi was isolated from Philippine macaque in 1961. And the first naturally human infection was reported in 1965 in Malaysia. And through the years, we have two known cases of malaria caused by Plasmodium knowles in the Philippines, one in 2006 and one in 2008. Currently, there are 2,768 cases of malaria from Malaysia, Thailand, and Indonesia, but none in the Philippines. These are the two cases of malaria that have been identified, Plasmodium knowles malaria that have been identified in the Philippines. This was our patient in 2006, and this is our patient in 2008. For the vector, Anopheles is the well-known vector for malaria. And for the current malaria situation in the Philippines, there was a drastic steady decline in the number of cases in malaria in the Philippines, and that is why we have shifted from malaria control, and now we are going to malaria elimination in the Philippines. If we're going to compare the endemicity of malaria in 2013 and now in 2023, so 10 years ago, and if you're going to compare, you can see that 10 years ago, there are still 53 malaria endemic provinces in the Philippines. Okay? And only 27 provinces are malaria-free in the Philippines. And the highest number of malaria during that time was in Palawan, Tawi-Tawi, Sulu, Maguindanao, and in Zambales. But 10 years after, or in 2023, in 2020, or now 2023, the only remaining foci of malaria in the Philippines is in Palawan. Okay, it is only in Palawan wherein malaria is still endemic. There are two provinces that still has malaria and has not reached the elimination phase. That is in Occidental Mindoro and in Sultan Kudarat. Okay. For Palawan, most of the cases came from the southern part of Palawan, and most of the cases came from the town of Rizal. So again, provinces in elimination phase include Sultan Kudarat and Occidental Mindoro, which still has less than 10 indigenous cases in the in 2019, and we have one province wherein Palawan, wherein malaria is still endemic, that is in Palawan. And as you can see from this slide, consider the hotspot is the southern part of Palawan, and the high clustering is also seen in the southern part of Palawan. For the diagnosis of malaria, before we used the microscopy for the diagnosis of malaria, but now with the intensification of the program against malaria, we are now using rapid diagnostic tests. For the treatment, we have chloroquine and primaquine and artemether plus lumefantrine for the treatment of malaria. For prophylaxis, if you're going to go to Palawan, we highly recommend that you use prophylaxis in the form of doxycycline at 100 milligrams daily for 2 to 3 days before going to Palawan. And then you continue taking doxycycline while in the endemic area and for 4 more weeks after leaving Palawan. For pregnant women, because of the high toxicity of doxycycline for the unborn child, we recommend the use of sulfadoxine plus pyrimethamine. And these are the programs that we are currently implementing for malaria in the Philippines. And most of these programs are now centered to the province of Palawan. So we have malaria halfway homes. These are constructed in Batarasa, Brooks Point, and in Rizal in Palawan, wherein we give supervised treatment, or just like the directly observed treatment strategy of TB. And those with malaria are partly quarantined in these halfway homes, and they are given free meals as well. We also still use the long-lasting insecticide-treated nets. And for the current program, they have recommended the use of conical nets for individual subjects, and for the family use, we still use the rectangular. for the province for Palawan, especially in Rizal, they use giant communal nets in the marketplace. These are used for children who stayed overnight for video games. Don't ask me why they allow children to stay overnight for video games, because I don't know why. We still have the indoor residual spraying for malaria, and that is one of the difference between the malaria program and the dengue control program. In the dengue control program, we do not advocate for the use of insecticide spraying, but in the malaria control program, we do advocate for the insecticide spraying. The malaria control program also has this private hospital engagement wherein the doctors and nurses in the hospital and the laboratory are trained on how to properly diagnose and manage malaria, which causes the decline in the number of deaths due to malaria. And we're still having these malaria-free validation visits for provinces who are applying to be called as malaria-free. So we're hoping that Sultan Kudarat and Occidental Mindoro will be declared as malaria-free already. And these are some of the information materials that we used, that the Department of Health is using for malaria. And these are the current threats to our program for the malaria control program, not only in the Philippines, but in the world. So one of the threats is this deletion in the P. falciparum histidine rich protein 2 and protein 3 genes. Our rapid diagnostic test uses this HRP2 to detect malaria. And if this HRP2 and P3 is missing, then we will not be able to diagnose malaria and we will have a lot of false negative malaria cases. These are the estimated prevalence of HRP2 gene deletions in 2022, and we have no data for that in the Philippines. We also have a lot of ongoing antimicrobial resistance for malaria. So the one in light blue are those who have less than 10%, and those with dark blue are more than 10% resistance. Not only for the drugs, but also resistance with the insecticides that we are using for the indoor residual spraying. As you can see, for the Philippines, we have 2 to 3 insecticide resistance in the Philippines. So in summary, I have told you about the global and Philippine burden of malaria, the Natural HIstory of Malaria, and the Department of Health Program for Malaria. So these are my references, the World Malaria Report for 2023 and the Philippine National Strategic Plan for Malaria 2020 and 2022. So for any questions, you may use the discussion part in Canvas for your questions. And we will also have our question and answer portion during the last 30 minutes of the lecture, of the session. Okay, so thank you very much, everyone. And please evaluate the lecture.